Hi there, my name is Ed and I'm a junior practitioner here at Private Therapy Clinic. I've been at the clinic for well over a year now and treat a wide variety of disorders, including but not limited to depression, anxiety, stress, panic disorder and paranoid thoughts. I'm also an attention deficit hyperactivity disorder coach, or ADHD coach for short. Prior to working at the clinic, I finished a degree in psychology at the University of Exeter before going on to work at an SEMH Vulnerable School. That stands for Social, Emotional and Mental Health Vulnerable School, or Special Education. I worked with people from year 6 to year 11, presenting difficulties mainly based in ADHD and or autism. I went on from here then to start on the internship program at the clinic where I was trained in Cognitive Behavioural Therapy, or CBT for short, and Psychodynamic Therapy. I mentioned just a moment ago paranoid thoughts as something I'm particularly interested in here at the clinic. I first became aware of paranoid thoughts when I joined the clinic just after lockdown. The NHS produced research that showed an increase in referrals to mental health services by 75% in delusions and hallucinations during and after the COVID-19 pandemic. Persecutory delusions, one of the 9 types of delusions, otherwise known as paranoid thoughts, suspicious thoughts or thoughts of mistrust, is something I'm very interested in and has gained rapid increase in referrals in the past 3 years. And there's a reason for this. COVID-19 has created immense pressure, stress and isolation on people, but that's not all. We live in a society where now more than ever we're taught to be fearful and suspicious. You can't walk through a town centre without CCTV watching you. You can't get on a train without being told to look for suspicious items. Conspiracy theories are on the internet in the masses, and violent crimes are reported in newspapers at a rate higher than ever. From a young age, we're taught that the world is a dangerous place and we need to be sensible. And in certain contexts, this is definitely true. Being wary is the most sensible option. Now, I know some of you are probably sat there thinking, well, I have paranoid and suspicious thoughts all the time. When do I need to get help for them? These aren't the kind of paranoid and suspicious thoughts I'm talking about. Paranoid and suspicious thoughts are innate and natural, and most of us at some point in our life will experience them. The kind of paranoid and suspicious thoughts I'm talking about are unfounded fears. Unfounded fears don't help us stay safe, but bring about all manners of distress. But it's okay, they're not inevitable, and in fact they're very, very changeable. So when you come to therapy, what would it look like? Well, the first couple of sessions will normally start with an assessment of sorts. I want to understand your situation, what causes them and what are your immediate stresses. From here we'll go on to look to explain the CBT model, how it works, develop a treatment plan, and then start a shared formulation. We'll look at the precipitating factors, the why now, the predisposing factors, the why you, and the protective factors of what helps. We'll go on from here then to look at a maintenance cycle to understand what keeps your paranoid and suspicious thoughts going continuously, and we'll look to challenge that with behavioural and cognitive intervention before moving on to relapse management techniques. Now, while I know a bit about depression, anxiety, CBT and paranoid thoughts, only you are the expert of you. And so I strongly believe that therapy has to be a collaborative process. Coming to therapy, I'll even make time for feedback at the end of some sessions for positive or constructive criticism for us to improve the treatment program just for you. Individual differences are a big thing in therapy, and what might work for one person isn't going to work for you, which is why it's important to take each person separately and treat their own problems as different to the last person. The importance of feedback allows this process to grow and helps make the best therapy for you. Now, coming to therapy and talking about the difficulties and stresses you've had recently in your life can be really challenging. After all, I'm a stranger and this is likely the first time you're hearing my voice or seeing my face, which is okay. I'm happy to take therapy at your pace and we can have the more challenging conversations further down the line. Moving away from psychology specifically, I'm going to tell you a few things about myself. I find it might be easier to talk about difficult things if you actually know a thing or two about the person you're speaking to. So I've got a few hobbies. I like chess, I like music, I've played in a band and I play bass guitar for about 10 years. And more recently I've got into reading and learning Italian, strangely. I'm someone who's severely dysgraphic and very dyslexic. And so reading, writing, languages and speaking in front of classes has always been something that's made me very anxious and really uncomfortable. In fact, as ridiculous as it sounds, it was only a year ago I picked up a book that wasn't psychology that I wanted to read, that I started and finished completely. It wasn't easy at first. In fact, I found it kind of uncomfortable. This is something that's caused me great anxiety for most of my life, but I persisted through the difficulty and eventually I ended up loving reading. I now read for fun often and I'm learning a language, something I never thought I would have done 5 years ago. So if you need help with your paranoid thoughts, you have mild or more severe depression, or want to tackle your anxieties for something you know has been lingering for a long time, then book in at Private Therapy Clinic and speak to me in the near future.